Hi, it's Dr. Buford. We're just getting started on your right shoulder. We're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen. Here's the biceps tendon running up as it exits the shoulder. Remember that you're laying on your side, so this is the socket here. The ball part, or the humeral head, is up at the top of the screen here. That looks pretty good. As we look down at the glenoid, it looks pretty good too. I don't see much degenerative change. We can rotate down. Shoulder's a little tight, which indicates you've got a little bit of capsulitis going on, which is not unexpected because of the injuries that you've had. Now, instability's not been your problem, but this biceps pain has been. So here's the area where the biceps is torn. You can see the torn edge. I'm trying to slip into the joint and show you there. We're going to take a pair of scissors here, and right off the bat, we're going to release the biceps, because that is the main reason we're here. Now, releasing the biceps is really no more complicated than cutting it just like that. And right now you can see how much more it opens up the joint. I'm going to put that cannula back in. And we'll show you some more in just a minute. Okay, so we've released the biceps. We've trimmed back this torn labrum enough. I don't think I need to do any more there because the biceps is no longer attached. That should recover. You can see how red and angry the tissues are. That should also recover as we get your motion back. We can look up at the rotator cuff and confirm that it's intact, so that's a good thing. I'm going to go ahead and stop inside the joint and get to the subacromial space so we can have a look up there. Okay, I just want to show you, we're up in the subacromial space, so we're above the rotator cuff tendon. The freshly cut edge of the acromion is at the top of the screen. As I rotate the camera around, we can see the anterior edge of the acromion out here, so we know that this is nice and flat. The clavicle is actually going to be back right there. And other than sweeping under it a little bit, I don't see the need to do a complete distal clavicle resection. I don't feel any pinching. We didn't have any on the x-ray. But we have taken off a little bit of the anterior lip of the acromion and lateral. So the final thing I want to do arthroscopically before we fix the biceps is look down at the rotator cuff. We're just trying to flush a bunch of water through right now. We're going to look down at the rotator cuff, and as we rotate an external rotation and abduct a little bit, that looks good. We can look towards the posterior aspect of the cuff here, all the way lateral, and there's no signs of any damage to the cuff here. So I think we're going to finish up here and get you back to the recovery room shortly after we fix the biceps, but as far as the arthroscopy, I think we're done with that part of the surgery, okay? So this will be the end of the video, though. So good luck to you now. Bye-bye.